Well, hello everyone, and thank you so much for joining today's session entitled Cooking with Gas, the Health Harms from Gas Stoves. My name is Zach Williams, and I am the Health Educator and Campaign Coordinator for the Environment and Health Program with Physicians for Social Responsibility in the National Office. I would like to thank you all for joining today's presentation, which will be about 45 to 60 minutes. And I would also like to thank Becky Bernhardt and everyone at Texas PSR for allowing me to have this opportunity to come and talk to you all tonight. First, some logistics. As I begin with the presentation and continue with the presentation, please drop any and all questions you have in the box labeled Q&A at the bottom of your screen. I will be going through those questions that are dropped into that Q&A box at the end of the training. And if we run out of time and I don't get to your question, I do apologize. My email is on the screen. I'll also drop it into the chat really quick for everyone. Please, by all means, email me, and happy to have a conversation to continue and answer any of your questions. All righty, so without further ado, I don't think I need to explain who PSR is to this group, so I'll really quick go through this slide. We know who we are. We're a national nonprofit founded by physicians with 33,000 members and activists, and we mobilize physicians and health professionals around the world to advocate for climate solutions and a nuclear weapons-free world. And of course, we have chapters all over the country, like the lovely Texas PSR, which is hosting us tonight. For our learning objectives, here's a brief overview of what participants can expect to be able to do by the end of this session. First, you will be able to articulate how cooking with gas appliances produces dangerous indoor air pollution and explain the health effects of each of those pollutants. You'll be able to recognize and prioritize vulnerable populations as well as understand why they are vulnerable. And you will be able to address the health effects of gas stove pollution and explain to patients the steps they can take to reduce their risk. This training is also CME and CEU accredited for physicians and nurses. So here is a lot of big admin, a big paragraph just explaining that. This slide is telling you that I am not selling you anything, I promise. And right before we get into it, I have a short pretest that I would like everyone to complete. You can either scan the QR code on the screen, or I am about to drop the link right into the chat as well if you don't want to deal with scanning the QR code on your phone. So if everyone could please take a moment to complete the short pretest. It's about 5 questions, multiple choice questions on a Google form. And we will come back in about 3 minutes. Shouldn't take you more than that, no worries. Alrighty, folks, I know that was about 2 minutes. I said 3 minutes. And don't worry if you haven't completed it yet. It's truly not the end of the world. So let's jump right into the first part of this training, which is a little interactive. And I'd like to hear some responses for you. I have a question for the group. What is the first thing that comes to your mind when you think of gas stoves? Put it in the chat. You can raise your hand and I can unmute you. I usually set these webinars up so you can unmute yourself, but it does look like that you all do not have the ability to unmute yourself. So if any brave soul, wants to drop their answer in the chat or raise their hand, by all means. It's the first thing that comes to your mind when you think of a gas stove. A good tool for cooking. Absolutely. It gets the job done. Can boil water in like 30 seconds. Rapid adjustability of the temperature. Absolutely. Better control for cooking. Okay. Has the better reputation for cooking. Sure thing. So it sounds like we have some pretty positive connotations when it comes with cooking on a gas stove. but always smells like leaking gas every time you turn it on. Absolutely, you know, that methane just hits you right in the face. Thank you for everyone for bringing up these positive connotations, because the thing that comes to my mind is that you know, colloquialism we have in the United States, cooking with gas. You know, it's a positive thing. You know, your car won't start, and then it finally does, and now we're cooking with gas. However, oh, and also clean and efficient and supposedly better control at the cooktop. So again, we have these positive connotations when it comes with gas. It's kind of this prestige thing. Like when you walk into someone's home, you say, oh, you have a gas stove, how nice. But at the end of the day, we know that this is a training about the health harms that comes from cooking with gas. So no matter what you think about gas stoves, the fact remains that using a gas stove without ventilation produces dangerous amounts of indoor air pollution, which leads us to the first section of this training, understanding the pollutants produced by gas stoves and the health effects they have on the human body. The primary pollutants produced by gas stoves include nitrogen dioxide, carbon monoxide, and particulate matter, including both PM 2.5 and PM 0.1. PM 0.1 is also known as ultrafine particulate matter, if you've ever heard that phrase before as well. Now, let's dive into what each of these pollutants actually do to the human body. First and foremost, let's look at nitrogen dioxide. It is a harmful air pollutant that is produced by the combustion of fossil fuels, including the methane we burn in stoves. NO2 contributes to the development of asthma, aggravated asthma, and increased susceptibility of respiratory infections. It is also associated with negative general cognitive functioning. Next, let's talk about carbon monoxide, which is probably more well known than nitrogen dioxide as a dangerous air pollutant. Exposure to CO can have neurological effects such as fatigue, impaired vision, dizziness, and all the way to falling into a coma. And for cardiac patients, carbon monoxide can also cause chest pain. And of course, at high enough levels or at long enough exposures, carbon monoxide can also lead to death. Lastly, let's look at particulate matter, both PM 2.5 and ultrafine particulate matter. For context, PM 2.5 is any matter that is smaller than 2.5 microns in diameter, and PM 0.1 is any matter that is smaller than 100 nanometers. For context, particles smaller than 2.5 microns settle on the alveoli walls, where they then set off a cascade of inflammatory changes that lead to heart and lung disease. Ultrafine particles, these that are smaller than 100 nanometers, actually translocate directly into the bloodstream through both the lung and sinus vasculature and distribute widely throughout the body, cross the blood-brain barrier, and can accumulate in brain tissue as well. Both PM 2.5 and PM 0.1 can aggravate asthma, decrease lung function, and increase respiratory symptoms. It can also contribute to non-fatal heart attacks, irregular heartbeat, and premature death in people with heart and lung disease. PM 2.5 and PM 0.1 have an asterisk next to it because the level of PM 2.5 that is produced is really dependent on what is being cooked, the type of food that is in the pot or the pan. Particularly fats and oils tend to produce the most particulate matter when cooking. So these are all the awful things that the air pollutants do to the human body, but how much of it are we actually being exposed to? So let's look at some exposure data next. Here we have on the left-hand side, you can see the national standards and guidelines relating to NO2 specifically concentrations. The United States does not have indoor standards for indoor air pollution, so we use the outdoor standards as a reference. The US EPA National Outdoor Standard, as you can see, is 100 parts per billion, and the World Health Organization's indoor standard is 106 parts per billion. For context, 1 part per billion is like a single drop in an Olympic-sized swimming pool. So these, even though it's 100 parts per billion, that is still a very small amount. That is the limit for the hour-long exposure to nitrogen dioxide. Now, data from the Lawrence Berkeley National Laboratory showed that in houses that were less than 1,500 square feet, indoor air levels of NO2 exceeded ambient air standards more than 83% of the time when folks were cooking without ventilation. And that goes up to 100% of the time when folks were cooking in houses smaller than 1,000 square feet. So these data show that using a gas stove without ventilation produces dangerous levels of NO2. But let's look at this graphically to really understand what's going on here. So this is a graph I pulled from that Lawrence Berkeley National Laboratory study. Along here on the y-axis, we can see NO2 concentration. Right over here is the 100 parts per billion, which the EPA says, please do not breathe or be around more than 100 parts per billion for more than an hour. And on the x-axis, we can see time. This red line is the measured NO2 concentration in the kitchen. And this blue line is the measured NO2 concentration in a hallway or a bedroom that was farther away from the kitchen. This house 3, there were looking at about 8 or 9 houses in this study. House 3 was less than 1,000 square feet and did not have proper ventilation. So kind of the worst of the worst here. And as you can see, with each of these cooking functions that the researchers did, every single time they used that gas stove, that NO2 concentration was measurably above the EPA outdoor standard inside a small home's kitchen. So as we can see, using a gas stove produces levels of NO2 that the EPA and other health organizations say are dangerous. So we have these dangerous levels of air pollutants, but what does that actually do in terms of health? So let's zoom into a case study real quick and look at childhood asthma. So here's a study entitled Association of Changes in Air Quality with Incident Asthma in Children in California, 1993 to 2014. This is a multi-level longitudinal cohort study drawn from 3 waves of the Southern California Children's Health Study over a 21-year period. Essentially, it's one of the best in terms of research methods and looking at health effects over time. To explain what's going on graphically here real quick, let's focus on just this side where the nitrogen dioxide is. Each of these different colors is a different community within Southern California, primarily near Los Angeles. Over here on the y-axis is the asthma incidence rate, so the amount of times we're seeing childhood asthma. And over here on the x-axis is nitrogen dioxide concentration, but it is inversed. We have high concentration over here and low concentration over here. And as you can see, as LA got its act together and started to clean up the smog and the ozone that was plaguing the city for years, they saw a dramatic decrease in how many kids were being affected by asthma. So essentially, what I'm just trying to show you here, the main takeaway is that when you decrease ambient nitrogen dioxide and PM2.5, it's significantly associated with lower asthma incidence. So when we decrease the amount of air pollution, we see that there are less health effects, specifically on children. And the focus on children here is important because it leads us to the next section of this training, which is looking at vulnerable populations. Children happen to be one of the most vulnerable populations when it comes to gas stove pollution, and that's for a couple of reasons. First, children tend to have increased and higher breath rates. Children also have higher lung surface to body weight ratios and smaller bodies. So an NO2 concentration that could be safe for an adult could be harmful for a child. And children also have immature respiratory and immune systems and are still undergoing development and don't necessarily have the ability to deal with stressors the same way that adults can. I want to continue this conversation about vulnerable populations as well, because I want to talk about environmental justice as well, because not every child is exposed to gas stove pollutants equally, and thus the distribution of childhood asthma is skewed. The data that I'm about to show you right now comes from the National Center for Environmental Health's National Health Interview Survey and a study from the Journal of Urban Health. I'm not going to go through every prevalence data point because there's about to be a bunch of percentages on the screen, but I just want to explain and come across the idea that this is a health equity issue and there are health disparities when it comes to gas stove pollution. First, let's look at housing type. So 21.8% of children living in public housing have asthma, compared to just 7.38% of children living in private residences. The prevalence of asthma, next, if we look at race or ethnicity, the prevalence of asthma in Puerto Rican children is almost twice that of white children, and the prevalence of asthma in Black children is more than twice that of white children. And lastly, let's look at income level. 11.8% of children living below the poverty line deal with asthma, compared to just 5.9% of children who live 450% above the poverty level or higher. So living in a non-private dwelling, being Black, and living below the federal poverty level are all risk factors for childhood asthma, which is one of the most prominent health effects of gas stove use. And why is this? And to fully understand why this is going on, we need to look back at our history a little bit. So to understand the context of what's going on here, I first want to talk about what was going on in the mid-20th century. So federal housing and transportation policies pretty much codified prejudice and racism into the economic and geographic development of the United States in the mid-20th century. First, the Federal Housing Act of 1949 authorized the demolition of Black neighborhoods, and the Federal Aid Highway Act of 1956 authorized the demolition of urban neighborhoods which were labeled as urban slums and replaced them with the nascent interstate highway system. These urban slums were often poor communities, low-income communities, and often communities of color as well. So this not only severed communities, which were most often poor or communities of color, but also constructed long-term polluting transportation infrastructure next to, near, or through these communities. Secondly, although it is outlawed today, many majority Black and brown neighborhoods are still reeling from the effects of redlining. A real quick definition of redlining is it is a homeowner's loan corporation categorization strategy, where some neighborhoods were labeled as high risk, whose residents should not be given access to mortgages. These neighborhoods were outlined in red on their maps, where the term redlining comes from. However, redlining now refers to lending discrimination that bases a credit decision on the location of a property to the exclusion of characteristics of the borrower or that property, who the borrower is, and what neighborhood that property is located in. Redlining prevented investments in infrastructure, in green space, public transportation, business development, and all other aspects of city planning that make for a successful and prosperous neighborhood. Because banks refused to give loans to Black and brown Americans decades ago, their descendants now deal with increased levels of air pollution and a lack of political will to competently and systemically address these issues. And when I say lack of political will, I do not mean on the part of the citizens that live there. I do mean on the part of the people in power who have their hands on the levers and the ability to change things. Next, this environmental justice concept is not just a race issue. I do want to talk about socioeconomic status as well, because class is also a very important part of environmental justice. So this is a health equity issue, and lower income households are often at higher risk of being exposed to higher levels of air pollution. Why is this? For many reasons. First of all, it's important to, low income families tend to live in smaller unit sizes. And it's important to remember that a couple slides ago, I did say that homes that are less than 1,000 square feet exceed outdoor standards 100% of the time when you do not use ventilation. Along with smaller unit sizes, lower income folks also tend to have more people per home. So there are more people being exposed to the pollution, and there are more people using the kitchen. Next, low-income families are also more likely to live in older homes and have less control over the maintenance of their appliances. Older homes may have gas stoves that haven't been properly adjusted, or may even still have a pilot light, and are more likely to have inadequate ventilation over the stove. Having cooking appliances with a pilot light, which I know most gas appliances don't anymore, but for those that still do, it's important to know that that means that there is just methane burning constantly in your home. It's great for when you want ramen noodles at 2 a.m., but also it means there is methane and natural gas burning in your home at all points of the day, which means there is nitrogen dioxide, CO, and PM 2.5 being pumped into your home at all points of the day. Next, low-income homes are more likely to use stoves and ovens for heat. Homes with inadequate ventilation, poor landlord management, and poor insulation makes families in these situations turn to the most readily available source for heat for relief, which is typically their kitchen oven, which is heating the home and providing relief from the cold while also pumping the home full of air pollutants. Next, low-income homes are also more likely to have higher exposure to outdoor air pollution for all the reasons I had said on the slide before. And also, finally, low-income homes are also more likely to already have a greater asthma burden, making them more sensitive to lower levels of nitrogen dioxide and other gas stove pollutants. Now, I just threw a lot of depressing information at you. But before we get to the solutions and the meat and potatoes of this presentation, I have another question for y'all. So have you ever seen any of these issues come up in your patients? And if you're not a professional that sees patients, have you ever seen these issues in your family, in your own experience, in your friends, and anyone you happen to live with? Have you ever noticed any of these health effects from using a gas appliance? You can drop it in the chat, raise your hand. And if you haven't, that's absolutely fine too. But I will say it's anecdotal evidence. It's not evidence. Not knowing if because of gas appliances, yes, sure. And we'll get to that, don't you worry, in the solutions, the vague symptomology. A personal anecdote I'll give is that a friend of mine for many, many years had a gas furnace. She heated her home. She lives in the San Francisco Bay Area, and she heated her home using a gas furnace. Every winter, her asthma and wheezing would get incredibly bad. Never really correlated it with any kind of heat. And as soon as she switched to an electric furnace, her wheezing and her asthma symptoms dramatically decreased during the winter. So she kind of put two and two together and saw, it's anecdotal evidence, but saw that stopping the use of that gas appliance led to, relief for her respiratory symptoms. Let's see some answers in the chat. Haven't inquired about gas stove use, but several patients living in small public housing units has respiratory issues with exacerbations. Always used to cough when using my gas stove, absolutely. So we do tend to see, even I acknowledge that there are so many confounders when it comes to this issue, especially with public housing. But we can see that there are some issues that come up when we use a gas stove. So let's get to the meat and potatoes of this presentation, which is going to be talking about solutions. Now, I want to take a moment to talk about solutions for a moment. To properly address this complex health issue, the solution should be multifaceted and systemic. First and foremost, the solution should address the target health effects the patient is experiencing and be within feasible and correct medical practice. Ideally, the solution should also incorporate and acknowledge the living environment of the target population and should aim to improve the quality of that environment. The intersection of these three core aspects is the ideal, most perfect situation. However, we all live in reality where that is hardly ever the case. So to that end, let's actually jump right into what we can do as health professionals to address this health issue. First and foremost, it's going to start like any other medical issue with risk assessment. When you're in the room with a patient, you want to see if they are a part of a vulnerable population and if they have any lifestyle risks or exhibit any behaviors that would put them at higher risk for exposure to air pollution and specifically gas stove pollution. We already talked about a couple of vulnerable populations, but here is a laundry list of more of them. Children, of course, the elderly, people living with diabetes, people of low socioeconomic status, people living with obesity, and also people with pre-existing heart and lung conditions are all at higher risk of developing more serious health issues because of gas stove pollution. Next, let's look at some lifestyle activities or behavioral risks that would increase your risk of gas stove pollution. So hobbies such as, do they run outside? Do they run in an area that has high levels of ambient air pollution? Do they use ventilation? Do they have access to ventilation when they cook in their kitchen? Do they smoke? Of course, someone who is a smoker already has some degradation of their lungs and will be at higher risk of developing a health issue from an air pollutant. Next, do they use fossil fuels inside the home? Do they even have a gas appliance? Do they use a gas stove? Next, time spent in traffic and in-car behaviors. Just as I said before, those long-term permanent transportation infrastructures, the highway system, in urban areas, they tend to be parking lots, and car exhaust is just pumping out at all points of the day. And also, what do they do in the car? Are they smoking in the car? Do they have the windows down? Are they being exposed to all of that pollution? And next, do they live near an industrial or a fracking site, which is going to have higher levels of outdoor ambient air pollution as well. Once we've assessed if they are a part of a vulnerable population or if they have any of these behavioral risks, let's then, of course, talk about risk management. First and foremost, at the patient level, when you're in the room with a patient, address the health conditions. And what I mean by this is, if the child doesn't have a rescue inhaler and they need a rescue inhaler, get them a rescue inhaler. A prescription for albuterol. The medical issue that is happening to your patient, address, which is, of course, within correct and standard medical practice. And I do want to talk about vague symptomology. Thank you for bringing that up in the chat before, because we need to keep in mind that all of those symptoms that I said on that slide before, coughing, wheezing, headaches, neurological issues, sinus congestion, a cough, all of these tend to be incredibly vague and could be anything, but they also could be signs of low levels of exposure to volatile organic compounds, carbon monoxide, PM 2.5. It could be exposure to gas stove pollution, absolutely. When you're not in the room with a patient, there's absolutely things we can do as health professionals as well. First and foremost, you can join or urge, if you have already joined, your state medical society or your medical specialty society to formally recognize the risk to health of asthmatic children with cooking with gas. The societies you're a part of should work to raise awareness among doctors and nurses by developing and distributing guidance and intervention recommendations. And raising your voice is one of the most powerful acts health professionals can do because we are trusted members of the community. Just a success story of something like this, the Massachusetts Medical Society did pass an acknowledgement and a resolution acknowledging the association between childhood asthma and gas stove use. And there are similar resolutions that haven't been passed yet, but that are being discussed in state medical societies around the country as well. Again, also, just to give another success story, the American Medical Association recognizes this, and their climate change policy, which they adopted in 2019, recognizes the importance of physician involvement in policymaking and encourages physicians to act as role models for sustainability. And this is one of the best ways we can by urging our medical societies to address this issue from fossil fuel pollution. Lastly, you can contact your local county or state legislators and ask them about any current electrification bills or policies that are on the table for this legislative season. And when I mean electrification bills, I mean bills that are looking to, at a large scale, electrify the housing stock so that we have less gas connections, need to frack less natural gas, and power and cook and heat our homes using electricity as opposed to natural gas. Supporting these legislative electrification efforts as a health professional will add the desperately needed health voice and weight to the movement and hopefully start to push some of these policies through. Now, this is what we can do as health professionals, but also we're people as individuals. What can we do and what can we tell our families and what can we tell our patients to do when they are in the kitchen cooking? How can they reduce their risk of exposure to pollution? So here's a great little summary slide, and I'll go through each of these bubbles real quick. First and foremost, you can install and maintain a carbon monoxide detector. I do have to say about carbon monoxide detectors, this is something I learned recently. Most carbon monoxide detectors are set to go off at levels where it's fatal, where you're at risk of dying because the carbon monoxide concentration is so high. Now, there are carbon monoxide detector models that are set at levels low enough where the low level exposure that is coming from your gas stove, it will be set off. So if that is an option that you would like to undergo, I would just say as a little asterisk, make sure it's a low level carbon monoxide monitor. Next, if it's available, run your exhaust hood over the stove. I know it's loud, I know it may be a little annoying, but it is one of the best ways to get ventilation and airflow going in your kitchen, which is the ultimate end goal of this. Is I want you to remember ventilate, 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 open a window, get that airflow going, and get those air pollutants out of the kitchen. Also, about using your exhaust hood, I'll skip right down to cook on the back burners. Cooking on the back burners of your stove means it's much more likely that any pollutant that is coming off of that pot or pan or from that burner is going to get caught by the exhaust hood, as opposed to cooking on the front burner, where it's much more likely just to spill over right into your kitchen and miss the exhaust hood. Next, you can try using an electric appliance like a toaster oven, an air fryer, a kettle to boil your water, anything that is going to reduce the use of that gas range. However, if you are looking for that pan fry on a burner, that type of cooking, I would also suggest trying a plug-in countertop induction stove. Again, I'm not trying to sell you anything, I promise, but I've done some research on some online retailers. A single burner goes for around 60 bucks. A double burner is about 120, 110. I know that's a lot for a countertop appliance, but again, if you're trying to reduce your gas stove use as much as possible, put a big old cutting board right over that gas range and use that plug-in, plug-out induction burner, induction stove when you would like to pan fry. However, to get at the root cause of this issue, which of course is gas stove pollution leading to respiratory and neurological effects, it's switching to an induction or an electric induction stove and getting rid of the gas appliance. Now, I know not everyone is made of money, especially now over these past 2 years, but if the couple grand it probably will cost to replace the gas stove in general, that plug-in, plug-out countertop induction burner is a great option as well. I do want to give a little bit of a spotlight to the induction stovetop and electric cooking in general, because I know we may have this image in our mind of horror stories of electric stoves, those resistance coils. It took 84 years to boil water, kind of smelled bad, the entire range would get hot. But luckily, we're in the 21st century now, and there have been some wonderful improvements to electric stovetops and electric cooking. So I want to spotlight the induction stovetop for a couple reasons. First and foremost, it's electric, so there's no indoor fossil fuel pollution in your kitchen. Caveat, I didn't say there's no fossil fuel pollution. Most electricity in the United States is generated by the combustion of fossil fuels. So I do acknowledge that simply using electricity doesn't reduce your fossil fuel use, because of course, the power plant is going to be burning fossil fuels more than likely. However, there is no fossil fuel pollution inside your kitchen when you use an induction stove. Next, it lowers household accident risk, because how induction stovetops work is they work through magnetism. So a magnetic field is generated by an electric current going through a coil, and that magnetic field interacts with charged particles in the physical pan or pot that you have on the stovetop, and the resistance to that magnetic field is what makes the pan hot, is what makes it is what makes it get hot enough to cook. However, it is only the pan that gets hot. Your stove top and the entire range is not going to get screaming hot. So if you have a little one who is touching and grabbing, you know, and they accidentally go and grab the top of the countertop, they won't burn their hand on a very hot stove. Don't let them touch the pot. The pot's going to still be hot. But the entire appliance itself isn't going to get dangerously hot. To that point as well, because I said it works through magnetism, pots and pans that are magnetic are going to work on induction stoves. So stainless steel, pretty much any pot or pan you can get at Target, Walmart, any kind of typical standard cookware. The very nice ceramic tortilla warmer that you have, unfortunately, will not work on an induction stove because it is ceramic. However, every other kind of magnetic pot or pan can work on an induction stove. And lastly, it's an investment in your family's health. Again, I know not everyone is made of money. Not everyone even has the ability to if you rent and can't change the format of your home. But if you do have the ability to switch to an induction stovetop, I absolutely recommend it because you are absolutely decreasing the amount of air pollution that is within your home when you cook. Next, and almost finally, before our Q&A section, thank you so much for sitting here patiently for listening to me talk for 45 minutes. I want to just highlight something that is being touted as a solution, but it certainly is not. And that is hydrogen blending. And this is a wonderful opportunity to health professionals to raise your voice. Because essentially what's going on here is the gas industry is seeing that they see the writing on the wall and they know that they have to greenify their industry somehow to stay afloat. And so what they are proposing is that to lower the amount of methane that is being used in the system by blending hydrogen gas in the system instead, ultimately saying we use less methane, we need to frack less, so that and hydrogen is going to, you know, take up whatever amount of methane is taken away. However, I do have to tell you that that is an incredibly bad idea for two reasons. One, it's bad for the climate. Hydrogen, to get hydrogen gas in a form that is usable for us is an incredibly energy intensive process that uses a ton of electricity generated by fossil fuels. So to produce the hydrogen that they are touting is going to reduce the amount of natural gas being fracked, they need to frack more natural gas to get the hydrogen. So more fossil fuels are being pumped into the atmosphere to make the hydrogen that is going to be blended. You may have heard the term green hydrogen, which technically is a green renewable resource. It is generated through a process called hydrolysis, and the electricity needed for that hydrolysis is generated by solar and wind. So there is no fossil fuel combustion in generating green hydrogen. Green hydrogen accounts for 0.1% of our nation's supply of hydrogen. It is nowhere near at scale ready to do what the natural gas industry says it is going to do. Next, and where health professionals come in, is that it's actually worse for our health as well. So what happens when we blend hydrogen and methane together and burn it is more nitrogen dioxide is produced in that soup than if it was just methane alone. So a hydrogen and methane blend has more NO2 than just methane alone. So it's actually not better for the climate, and it's not cleaner or better for our health. So if you see this coming to Texas, if people are starting to talk about hydrogen blending, raise your hand and say, hold on, wait 1 second, not so much and not here. So with that, thank you very much for listening to me speak at you for 46 minutes. And before we get to the Q&A portion, I would also love if you can take this little post test. I will also drop the link in the chat real quick if you don't want to scan the QR code. There we go. It is the same group of 5 or 6 questions. We just want to see if there was any learning that happened over this webinar. And then the next section is just a quick review and evaluation of how this training went, how you liked it, anything we could improve on, and your feedback and would be greatly, greatly appreciated. As we know as health professionals, it's data, 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 data. So thank you so much. I will pause the recording and give us maybe a true 3 minutes, and then we'll get going for the Q&A portion. Thanks so much, y'all. Alrighty, folks, thank you so much. Before we jump into the Q&A portion of this webinar, I do just want to highlight the work that Physicians for Social Responsibility is doing in the building electrification sector, which this entire webinar is geared towards. I won't go with this entire laundry list, but we've had some building codes change in 3 major cities in Washington. We've had some health PSAs been put out on the NBC affiliate in Colorado. The Massachusetts Medical Society passed the resolution acknowledging gas stoves and asthma, thanks to Greater Boston PSR. And also our folks in Philadelphia with PSR Pennsylvania are also helping low-income folks with home rehabilitation programs to help with the electric transition, which is really crucial because it's all well and good if we shout about how bad gas stoves are, but if no one can afford to rehabilitate their home, what good is it, you know? So this is just a little bit about Physicians for Social Responsibility. I'm sure you all are already all members, but if you would like to join us, please do. Something I would like to tout for a little bit is PSR National has a wonderful program called the Climate Ambassadors Program. If this really lit a fire under your butt and you really want to get involved in climate and renewable energy work, I highly advocate for you to come join us and become a climate ambassador with PSR National. You get to work hand in hand with staff members on specifically climate, renewable energy, and environmental work. So I just dropped the link in the chat if that interests you at all. And for our folks that are looking to claim CME or CEU credit at the end of this webinar, I will drop a link in the chat real quick. If you would like to claim credit, you can follow the link in the chat. You can scan that QR code on your phone. And I can also really quick, oh no, there we go. So I dropped the link in the chat and you could also scan that QR code as well if you would like credit. And without further ado, then let's open it up for questions. So let me open up this Q&A box really quick. And let's chat. Okay, first one from Arthur. If PM 2.5 and PM 0.1 depend on what is being cooked, why does it not happen with electric cooking, or does it? Very good question. So PM 2.5, the particulate matter is definitely contingent on what is being cooked. However, also if you turn on a gas burner, there are low levels of particulate matter that are produced as well. So it's not solely based on what is happening in the pot or pan. And absolutely as well, particulate matter is going to be produced and pumped into your kitchen with an electric stove as well. It is simply just the nature of pan frying, of using, of searing, of, you know, cooking anything in a pot or pan. Some of that particulate matter is going to become airborne and become an air pollutant. But however, there are much lower levels of air pollutants when you use electric cooking as opposed to gas cooking. Next, Lisa Doggett, can you comment on gas fireplaces? Are they as bad as gas stoves? Now, Lisa, I don't want to lie to you because I am not a gas fireplace expert by any means. However, I could say that it is a gas appliance, so it uses methane gas and it combusts methane gas. So all of those pollutants that I went through, NO2, CO, and PM 2.5, I'll say NO2 and CO particularly, are created when you combust methane. So any appliance in your home that combusts methane is going to be producing those air pollutants as well. Specifically gas fireplaces and the levels of exposure you get from them, I don't have that answer for you, I'm so sorry. And if they are as bad as gas stoves, I don't know. But they certainly do. If methane is being combusted, NO2 and CO are being pumped into the air. Next, we have one from Lucille. What about the use of gas furnaces? A lot more gas, particularly in the winter. Absolutely. So again, just as I said, any appliance that is burning methane gas to do its function is going to produce the air pollutants, NO2, CO, low levels of benzene, low levels of formaldehyde. And again, you're right, particularly in the winter, it uses a lot more gas. And I'll just say it's anecdotal evidence, but the personal anecdote I gave of my friend where she had really, really bad respiratory symptoms in the winter when her gas furnace was going and going and going. And as soon as she switched to an electric one, her asthma symptoms really did start to subside and the wheezing got better as well. So again, the gas furnace, the same thought process applies. In terms of solutions, of course, you can't cook on the back burner of a gas furnace, but it is the same solution of trying to transition away from a methane gas appliance. Next, we have another question from Lisa. Have there been any thoughts about how someone converting gas to electric stoves? It's a long shot, but it seems like it'd be a good way to preserve the structure of the stove oven. I see, like retrofitting a gas stove to then become an electric stove. That is if you figure out how to do that, patent it and become a billionaire, because you'll make a lot of money if you do that. I don't know actually if there are any retrofit or programs like that. Often what folks are looking at now is trying like what to do with the gas stove when it's already out and replaced with an electric stove. However, I'm sorry, I am not a mechanical engineer. I wish I was, but I do not know how you would convert a gas stove to an electric stove. It seems like the piping and the burners and the inner workings of it seem to be pretty much made to be a methane gas appliance. But who knows, maybe some brilliant person in a couple years will come through and say, hi everyone, here's an incredible solution to do that. But you're right, it would be a great way to preserve the infrastructure and not have to have this massive investment in changing everything, All right, last question that oh, no, we have more, there we go. All right, from Matt, do you have any tips for methane emitted when the stove is not in use? Is it only methane that is emitted when it is not in use, not NOx or PM 2.5? So Matt, thank you so much for asking this question, because there are two scientific studies, one published and one about to be, keep your ear to the ground for it. First and foremost, there is a Stanford study that came out, I believe, in January of this year that showed that our gas appliances are actually leaking a lot more methane than we ever thought. And that also goes for pipelines as well. There's a lot of fugitive gas emissions in our pipeline infrastructure around the nation as well. But specifically the appliances, there's a Stanford study that shows that our gas appliances are leaking methane at rates more than we ever thought they were. And thank you for bringing it up. It's not only just methane. There are a group of air pollutants called BTEX. I'll put that in the chat. Forgive me, I do forget what B, E, and X stand for, but I do know T stands for toluene. So when methane leaks from a gas appliance, BTEX also does come with it. And that's the study that's about to be published, I do believe, in a matter of weeks or maybe in the next month and a half. So that hopefully will be a bit of a bombshell like the Stanford study was, to show that these fugitive emissions are also bad for our health, even when the methane isn't being combusted. And another question from Matt. I have tried in 2 houses to convert to a gas cooktop, and it would be $7K to put a 50-watt amp in, $6K in another house. Again, it's not everyone is made of money. I do absolutely have to say, and the induction stovetops are kind of like that prestige item now, that gas stoves where it was like, oh, you walk in, you have a gas stove, and now you walk in and they have that fancy glass, induction stovetop. And again, it's a pretty penny to do it. If you have the means to do it, I urge you to. If you don't, I certainly don't have $7 grand to rip that gas stove out of my kitchen. But a solution, a mitigation strategy for that is that plug in, plug out countertop induction burner. It's around 60, maybe 120 bucks. And that could be a good solution if you don't want to, use the gas stove. So I see those are all of the questions from the Q&A chat. I'm just going to quick scroll through the chat real quick. I see Rick, COPD to emphysema, exhaust fan, probably saved my life, a lot of harm, electric appliances. Great. Thank you so much, Rick, for sharing this. Great. And thank you, Becky. VTEC stands for benzene, toluene, ethylbenzene, and xylene. Not great things to be breathing into your lungs. So yes, that bombshell of a report should come out hopefully within the next week or next couple weeks or a month and a half. And oh, here we go. One last one from Lucille. I have heard of methane detecting cameras used a lot in factories. Is there a portable detector for methane? Lucille, that absolutely does sound like some industry, like an industrial quality, you know, like health and safety kind of OSHA monitoring thing. I don't know for residential if there's a portable detector for methane, similar to how like a carbon monoxide detector will go off. And I'd have to admit, I'm so sorry. I don't know if there's a portable household detector for methane, but definitely a good thing to look into if, again, the fugitive leaks from the gas stove, even when it's not on, is definitely something of concern. Alrighty, folks, so it is 8:58. We are 2 minutes under, which is great. I just want to thank you all again for a wonderful presentation. Thank you so much for joining today and for listening. And I hope all of you have a wonderful rest of your night. I am going to drop in the chat real quick. We have a couple of fact sheets that, you know what, I'll send it to you in an email because my Google Drive is giving me issues right now. Alrighty, folks, that's all I had. Thank you so much for a wonderful, wonderful night. And I hope you all have a great rest of your night. Thanks, folks.